Welcome, everyone. Hello. Good to see folks here at noon, and I'm very delighted to welcome you to our seminar that's sponsored by our center, the Michigan Life Stage Environmental Exposures and Disease Center. And without further ado, I will turn it over to Amy Schulz to introduce the speakers and get us kicked off. So take it away, Amy.
Thank you so much, Marie. And I want to thank the IHSC Core for providing space for the Community Engagement Core to have sort of a mini-series within the context of their larger webinar series that they offer. The goal of this kind of subset of presentations is to illustrate the really exciting opportunities and the potential for bringing together researchers with community activists and advocates who are actively engaged in addressing environmental health issues that they're confronting in their own communities. We're really so excited to bring several presentations to this group, sharing some really exciting work that's been happening over the last several years. The presenting team, and Allison, you could go ahead and share slides, for today includes, there are four of us who will be co-presenting. Carina Gronlund is a research assistant professor at ISR, and she's a former center scientist affiliated with the M-LEEaD Center. Tony Reames is also joining us. He's an assistant professor at the School for Environment and Sustainability and has been a part of the team working on this initiative. Michelle Martinez is the executive director for the Michigan Environmental Justice Coalition, which is a statewide coalition spearheading environmental justice work and really sort of the brains, the impetus behind what we're going to be presenting to you today. And then I will also be playing a small role in the presentation, and I serve, I'm Amy Schulz. I'm a professor in the Department of Health, Behavior, and Health Education, and serve as the co-lead for the Community Engagement Core. And the title of our presentation today is Energy Equity, and we're going to be talking about a health impact assessment that we did of Detroit Energy's Integrated Resource Plan. And you can go ahead and go to the next slide, Allison. Thank you. Before we start, we just want to acknowledge the support from a wide range of organizations and groups that really help to make this work happen. Community Action to Promote Healthy Environments, the Work for Me DTE Coalition, the MEJC, of course, and then with resources, funding to support the work from the Graham Sustainability Institute, the NIH, and a pilot project funding from the M-LEEaD Center. We can go to the next slide. So some of you might be asking, what is a health impact assessment? Health impact assessments really are a tool for bringing science to the process of thinking about decisions. They're part of what sometimes gets called health in all policies. So really considering the health implications of policy decisions or programmatic decisions before those decisions are finalized and implemented. And the goal of these is to bring scientific evidence to bear and really to understand what are the likely health implications of a decision before it is made. These are somewhat different from what are commonly thought of as environmental risk assessments in environmental health, which tend to be very science-focused and probability-focused. Health impact assessments can encompass quantitative health assessments, and we're going to share some of those with you today. But as the term is used more broadly, health impact assessments have a strong emphasis on information, providing information as part of democratic decision-making processes. And as such, there's a strong emphasis on engagement of communities who are likely to be affected by the decision, making sure that they are part of both developing the information and thinking about the information. And there is a strong emphasis on equity analysis within the context of health impact assessments. So we're not only looking at broad overarching health impacts, but also bringing a lens to bear about what are the implications for equity. And you'll see that in some of what we're going to be sharing today. You can go to the next slide. Another part of the HIAs, as they're thought of as part of a democratic decision-making process, is they don't stop with just developing information about likely health impacts, but they include specific recommendations that can be implemented as part of the decision-making process to reduce the adverse health effects that have been identified through the HIA process, or more equitably distribute the health costs and benefits that are identified through the process. You can go to the next one. So in summary, the health impact assessment of the DTE Integrated Resource Plan, which we fondly call this project the HIA of the DTE IRP, are that there are benefits of energy production that are disproportionately realized throughout the Detroit metro area, which was the focal area for the study, and that the health costs associated with exposure to air pollution generated by the power plants are not currently considered as part of the decision-making process for energy planning. And we're going to talk to you, I'm going to turn it to Michelle now, and she's going to talk about that in a little bit more depth. So Michelle.
Hi, everyone, and thanks so much for joining us today. So we had to ask ourselves this question in the Detroit metro area when DTE proposed the IRP. And IRP, we came to learn, right, essentially is a 15-year energy plan for the utility that is mandated by state government. And the Michigan Public Service Commission oversees this process. And it has to address expected demand, retirement of power plants, timing, and amount of new electricity sources such as methane-fired gas generation and renewable energy. It also has to address customers' needs, the energy waste or energy efficiency, and the cost, right, as well as reliability, and also environmental impacts as overseen by EGLE. So an approved IRP, it very importantly allows the utility to obtain pre-approval for the recovery of cost for this infrastructure of near-term projects. So we found that getting involved in the IRP was critical for trying to understand how residents of Detroit and the Detroit metro area would be impacted by the utility. Next slide. And the reason that we were forced to engage in this process is because what was happening during this period was absolutely a mountain of environmental injustices that were occurring in our communities of Southeast Michigan. We realized in 2017 that DTE Energy's rush to natural gas under the Snyder administration was underway, most remarkably through the Certificate of Necessity process for a 1.1 gigawatt natural gas facility named the Blue Water Facility in Metro Detroit and St. Clair. We had the forthcoming River Rouge and Trenton coal plant closures, which are now imminent. And then we also had in 2017, community leaders in rural parts of Southeast Michigan fighting pipelines that were being laid at an exponential rate, the Nexus, the Vector, and the Rover, bringing Marcellus Shale to the Southeast Michigan area, particularly for export markets and threat of liquefied natural gas. By 2018, we were in just a deluge of permits for not only a Dearborn industrial gas generating facility across the street from Salina Elementary, which is the most polluted area in Michigan as per the air quality monitor on Salina Elementary's backyard. This is a picture of the meeting at Salina Elementary in which Dearborn residents mobilized to say no to this facility. I would say that even the translation into Arabic was poor and inadequate to even convey that there were 30 days for the agency to decide whether or not that permit would be approved or denied. Fortunately, Consumers Energy rescinded the proposal, but at the same time, the certificate of necessity for the DTE facility just 60 miles north was approved, and another natural gas permit was approved. All of this was in the span of 3 months. So you can imagine how we were just reeling from these late Snyder administration fast tracking of natural gas. So in 2019, we launched a campaign to be able to really build up and into understanding what DTE's IRP looked like, approaching University of Michigan and engaging in the health impact assessment. Our partner at Solidarity with the University of Chicago Abrams Legal Clinic began the intervention both in rate cases and the IRP, and really began interrogating whether or not community members had an opportunity even to give input into this process, and learned very quickly that we had to demand that the MPSC hold public hearings that would be put into the public register. By 2020, we had learned that the administrative law judge, the ALJ, had made an assessment that HIA should be considered an IRP, and yet the MPSC in December of 2019 ruled against their own ALJ. We were hit with COVID shortly after that decision, and we had to pivot to Turn It On, Keep It On campaign to the MPSC so that people were not getting utility shutoffs, and then pushing Governor Whitmer to create an executive order above and beyond the MPSC's ruling that would revisit health again in energy decision making. Next slide. So just so you know what the container for this work looks like is a Work For Me DTE campaign. And what we sought to do was build the leadership, build the future, focus on what kind of things we can build away from an extractive economy into a regenerative economy with our communities. Some of our partners like Solidarity, We Want Green Too, Citizens Resistance Against Fermi 2, Empower Michigan, really justice-centered environmental organizations, connecting, right? Bringing up energy fellows from most impacted communities and system impacted people to and with us to the hearings, doing popular education trainings, and with the help of the Energy Foundation, really honoring people's labor by subsidizing involvement, and then fighting right throughout the entire process. So on the right, you see a picture of Star Rowland, and Tinu is an amazing activist, and this is the March for the Green New Deal that we did before the Democratic National Convention, demanding that Detroit be the engine for the Green New Deal. So nonviolent direct action, community engagement, and building out the vision for the future is the campaign. And that matched with testing the democratic channels of the MPSC were definitely a part of how we began to build the vision for the future and the political possibility, right, for these solutions. So today, next slide, we are still embroiled in trying to figure out how these asks, these demands from the community can be institutionalized. And the executive order that was issued in late 2020 by Governor Whitmer said, right, that the department must consider environmental justice health impacts under MEPA, and that the commission's analysis of that evidence must be conducted in accordance with the standards of the IRP statute and filing requirements. Where that leaves us today is that we are asking the state to consider an EJ screen with health impact analysis and require that that data be provided. though DTE IRP is concluded, Consumers Energy IRP is still open, and we are hoping, right, as we continue to make energy decision makings in the state, that the state is empowered and the Public Service Commission is empowered to reject any plan that would exacerbate the disproportionalities. So I will hand the mic over to Carina to show exactly what the content of that HIA looks like. Thank you.
Oh, all right. Thank you, Michelle.
Excuse me. Go ahead, Joe.
It's fine. Yeah, I think, Michelle really painted the picture for why this conversation about energy justice and data analysis and data visualization is so important, so communities can continue to advocate for this type of analysis and decision-making process. And so one of those critical components of energy justice and how we push for energy democracy is to understand the distributional injustices and disparities, often through visualization. So over the next several slides, we'll be showing you a series of maps that demonstrate the distribution of various analyses that we've worked on as a group to understand how the related issues of the whole energy life cycle, from generation, consumption, and pollution, are looking across the metropolitan area. So just to orient you to the maps, we currently are doing the Tri-County area of Detroit. Starting in the top left square, you see Oakland County, over to the right, Macomb County, and then to the south, Wayne County and the city of Detroit, which is outlined in blue. On all of the maps, what you'll see is that the light yellow color indicates a lower value for whatever metric we're talking about, and the red, dark red, indicates a higher value. And then you can also see the locations of our power generating sites, whether it's a coal plant, natural gas, or oil plant, in kind of the blue and teal circles. So this first map we have before you illustrates the median annual electricity consumption at the census block group level. And what we see in this map is that there's, of course, higher electricity consumption in the suburban communities in the Detroit metro, while you see lower electricity consumption in cities like Pontiac and Detroit. Homes in the red areas consume 2 times the electricity as homes in the yellow areas. And we also notice that lower consumption corresponds with where our generating plants are. And so there's this imbalance between the suburban benefit of energy, electricity generation, and the burden of lower consumption in communities that host these dirty generating sites. Next slide, please. So when we go beyond electricity generation, one of the real issues that should also be a part of IRPs and energy waste reduction policies that DTE, consumers, and other utilities put forth is focusing on energy efficiency. We know that we have this combination of poor building codes, lower incomes, deferred maintenance, that really leads to people consuming more energy than they should be if their homes were more efficient. And so this map allows us to look at areas of high inefficiency in red and higher efficiency in yellow. And what we see is almost an inverse of that consumption map, where the areas in red are 2 times less efficient than the areas in yellow. And what we also see is the communities that are already bearing the burden of hosting electricity generating sites also have the least efficient housing. Next slide, please. And on top of that, Michelle mentioned the campaign to turn it on and keep it on. Electricity burden, the energy burden that people face, is really high. So if your house is inefficient, you're using more energy. If you have low incomes, you're losing a larger proportion of your income to electricity costs. And so we see that the areas are really red in and around the city of Detroit. Again, the communities that are hosting the dirty generating sites. And we know when the pandemic hit that energy poverty, energy burdens was already a big issue. But at the height of, or the beginning of the pandemic, some 50,000 households in Detroit were in arrears to DTE. And another 11,000 homes had already been shut off. And we know that there are some voluntary moratoriums in place. We're in the winter moratorium period now, but being able to visualize and show where energy burdens are highest will allow us to make sure that people are able to keep their power on after moratoriums go away, and maybe an end to this idea of electricity shutoff in general. So I'll go to the next slide and turn it over to Amy, who will show how these areas of electricity benefit relate to some other cumulative vulnerabilities.
Great, thank you, Tony. This slide is just, it takes one of the slides that Tony has already shared with us, the electricity consumption slide, and we can see that that slide illustrates inequities in the amount of energy, electricity that is consumed from the power plants. And you can see the power plants, they're indicated with the dark blue, the blue dots in the lower corner of that slide. We wanted to show how that inequitable distribution of electricity consumption maps onto population characteristics of people living in the Tri-County area. And that's the slide on the right, which is labeled cumulative vulnerability. And as in all the slides, we're looking at the yellow areas are the lowest levels. And then as they get increasingly darker red, we get to higher levels of cumulative vulnerability. And this is an index that is commonly used in identifying environmental justice communities and looking at multiple characteristics of the community that can increase their vulnerability. And those include things like the percent of the households that have incomes below the poverty line, the percent of households without a high school education, median household income, which is reverse coded, the percentage of renters that live in an area, and the percentage of households that are what gets called linguistically isolated. And that's defined as households that have no adults over the age of 18 that speak English as their first language. We also include in this indicator, this metric of cumulative vulnerability, two indicators of what are often called population susceptibility. The proportion of the population that's under the age of 5, and the proportion of the population that's over the age of 65. And those are included because people in those age groups, for developmental reasons and other health reasons, are often more susceptible to adverse health effects when they are exposed to air pollutants. And we show the two maps side by side, so we can also see that the areas that are disproportionately exposed to pollutants and have lowest levels of energy consumption tend to be the same census tracts that have high levels of cumulative vulnerability as it's defined on this scale. So they map onto each other. And if we go to the next slide, in the next slide, we just show those two same maps again. And on the left, the larger map shows the proportion of people of color in the Detroit metro area, predominantly non-Hispanic, Black, and Latino populations, as those are distributed. And again, we just show this so you can visualize the overlap in the population characteristics with these patterns of energy consumption that we're looking at. I'm going to move to the next slide, and I think now Carina is going to pick up. Is that right? Yeah, Carina.
Yeah, thanks, Amy. So, electricity, I want to start off by saying, has many health benefits. And one of the ways that people benefit from electricity is to cool their homes with air conditioning during extreme heat events. Unfortunately, air conditioning is an example of how the health benefits of electricity are not equally distributed, and annual health costs per person associated with extreme heat are higher in areas with less residential air conditioning availability. This is a map of the health costs associated with deaths and hospitalizations during extreme heat by census tract. And these risks are estimated using a model of air conditioning prevalence, actually that I created while I was a center scientist, Amy, along with results from epidemiologic studies of mortality and hospitalization rates during extreme heat events. And we can see from this map that on average, annual health costs per person vary from less than $1 to around $40. And these costs are greater in Wayne County and the city of Detroit, with high vulnerability in the older homes on the Lower East Side and in Northwest Detroit. The estimated mortality and hospital costs may be small, but this can also be regarded as a map of where suffering in summer heat is greater. Now, there are also associated disbenefits with electricity use because electricity use increases air pollution and global warming. Next slide. Now I'm going to talk about one of those disbenefits, DTE air pollution exposure. Using emissions estimates for 2018 through 2019 provided by DTE during the IRP process, we were able to model where those emissions travel and their chemical transformations using the CalPUF model. This map shows the areas with greater exposure to DTE air pollution, which are Eastern Wayne County and Southern Oakland and Macomb counties. Next slide. I'm going to skip this in the interests of time. Next slide. We can estimate from decades of epidemiologic research how smaller doses of air pollution can increase the risk of a variety of health outcomes, including asthma exacerbations, emergency department visits and hospitalizations, heart attacks, chronic bronchitis, and deaths due to cardiovascular, respiratory, and lung cancer causes. We calculated these estimates using standard EPA methods, namely the BenMap software, and we assigned dollar values to those healthcare costs and deaths, and then added all of those dollar costs together. If we put a dollar value on the healthcare costs and mortality, those health costs from DTE power plant air pollution sum to around $300 million annually across the Tri-County area. And across census tracts, if every census tract had the same age distribution, health costs would range from $27 per person to $115 per person annually. Next slide. So we can also look at individual health endpoints and focus in on asthma symptom days among children that are attributable to DTE power plants. That's the map on the left. And we see that the greater health burden is in the northeast and southwest sections of the city of Detroit. And the burden is greater here, both because these are areas that are more exposed to DTE air pollution, but also because these areas have a higher percentage of children. If we focus just on mortality from air pollution, the areas with greater vulnerability to DTE air pollution are those that are either highly exposed to DTE air pollution or areas with a high percentage of older adults. Next slide. Okay, so this again is a map of the average health costs per person attributable to air pollution from DTE, except that this time we account for those age differences and age distribution by census tract. And like Amy said, the very young and the individuals 65 and older, for various health reasons, are more vulnerable to air pollution. So again, the total costs across the Tri-County area are $300 million annually. But now when we break it down by census tract, the per capita costs range from less than $1 to over $200 per person. The burden's highest in certain areas of Detroit, but also in suburban tracts with a higher percentage of older adults. And I want to say there is uncertainty in these estimates and their spatial distribution, but in the census tracts with the highest estimates, so these are the dark red census tracts, attributable health costs could range from $20 to $400, and it's very difficult to also assign a value to life lost. We use the standard kind of EPA valuation of $8 million per life. But nevertheless, there are substantial health costs and a substantial burden any way you look at it. And the total health costs, when we account for all these uncertainties, are between $66 million and $570 million annually across the Tri-County region attributable to DTE air pollution. Next slide. So one of our goals with this project was to also look at future scenarios when plants are closed, not only according to the DTE IRP proposed schedule, but also according to a more aggressive schedule proposed by the NRDC and MEJC and others. So on the right, we show PM 2.5 exposures due to DTE power generation in the future when 3 power plants have been closed, and that includes River Rouge, St. Clair, and Trenton plants. And there are 2 things I want to point out. So the scale of these 2 maps are different. The previous map is one I already showed with, sort of present day exposures. So the highest quintile on the left only, it goes up to 0.32 micrograms per cubic meter. Well, the highest quintile on the right only goes up to 0.11 micrograms per cubic meter. So if the map scales were the same, all the areas on the right would be yellow or light orange. So everybody's exposure is reduced. The different scales allow us to see that the exposures in Southwest Detroit, the Trent enclosure now, also have a lower PM2.5 exposure relative to other areas with census tracts that were previously in the 4th quintile, the red ones now joining the 3rd dark orange quintile. Next slide. So with closure of these coal plants, the total annual impacts of DTE air pollution in the Tri-County region declines from $300 million to $89 million. And furthermore, you can see that the highest quintile of health costs per person is now $57 to $71 per person, instead of $174 to $218 per person. And the highest quintile after closing these plants is comparable to the 2nd quintile of present day DTE-related costs. Looking at specific neighborhoods, the areas with higher DTE-associated health burdens have higher absolute reductions in health costs too. For example, in the Gold Coast neighborhood north of Belle Isle, which is a neighborhood with senior high-rise buildings and an older population, the health burden goes from up to $218 per person to up to $57 per person, for a savings of around $160 per person. In Southwest Detroit, which has a relatively young population, the health costs go from $87 per person to $14 per person, for a savings of $73 per person. But in areas that were always in the lowest quintile, there are still some health savings, but they're less dramatic and are in the $1 to $30 range. Next slide. I'm going to pass it over to Amy now.
All right, great. Thank you, Carina. I think that those slides are just so powerful in illustrating both the inequitable distribution of risk now, but also the power of just shutting down those coal-fired power plants in terms of reducing overall health costs, and in particular health costs in neighborhoods that right now are disproportionately burdened by them. Thank you for sharing those. So, the set of slides that we've just looked at, the maps, really illustrate, I think, clearly that the costs of any energy production, including their associated health impacts of the pollution that's generated, fall disproportionately in low to moderate income neighborhoods. Those neighborhoods in the Detroit metro area are disproportionately African American and Latinx. The health burden and the associated costs also fall more heavily in census tracts that contain larger proportions of younger and oldest members of DMA communities. So they're a powerful way to visualize the inequitable distribution of risk. We can go to the next slide. So health impact assessments or integrated resource plans right now, as they are moved forward within the state of Michigan, do not include a requirement that they actually assess the likely health impacts of the energy mix that is being proposed. The kind of analysis that we just shared with you illustrates really clearly that there is disproportionate cost burden, disproportionate health burden, but that does not need to be put forward by the energy companies as they are proposing how they will be producing energy over the next 15 years. So our one recommendation is that health impact assessments should be required components of IRPs, and which would allow us to specifically evaluate the health costs. They are required to do affordability assessments, but those currently do not need to include health costs. So a second recommendation is that those affordability assessments should include the costs to health of air pollution, and also costs of climate change that associated with fossil fuels. They are also required to do some safety assessments, but again, those safety assessments don't include consideration of health. And so our recommendation is that they ought to. And when there is uncertainty about likely health impacts, that the option chosen should be a move towards cleaner and safer forms of energy production. I'm going to turn it back now to Michelle.
Great, thanks. And thanks so much to the researchers who provide an excellent technical analysis of exactly what we experience in the neighborhoods of Detroit and the Detroit area, and it's difficult and sad when we start thinking about elders in our community who haven't had heat in their home for 2 years because they simply cannot afford to update their homes, and being represented as a number, right? Thinking about folks in Southwest Detroit who suffer chronically from asthma and the benefits that they could get from early coal plant closure. So there are real people in real lives, right, that are on the line here in these numbers. So we do ask the Michigan Public Service Commission and Governor Whitmer to consider people's health when considering safety, that those who are exposed to pollutants from coal generation or power production, that their health be considered, and expand and encompass other health impacts like access to affordable, reliable, clean energy, efficiency programs, to excoriate the race in income and linguistic isolation, right, in energy burden. Consider graduated rate structures that other states have, right? Look at the reliability of outage maps by race. These are things that we don't do currently in Michigan, and we cannot root out systemic racism if we don't start looking at the data. Obviously, the costs that are associated with climate change are only likely to increase over time as we see increased disruptions, extreme heat, extreme cold, rain events, and we anticipate that these will also be disproportionately distributed by race, linguistic isolation, resulting in death, right, for low-income urban areas. So, these are real consequences, and there are things that can be done as evidenced by the HIA here. So next slide. Again, utilizing an EJ screening tool, a health impact analysis to assess and redress race, income, geography-based disparities of energy benefits and burdens, including air pollution, affordability and shutoffs, access to renewable resources, energy efficiency, and safety and reliability is the ask, right, to have a more just energy system. Next slide. So reiterating the same, energy justice means benefits and burdens being distributed without respect to race and incomes, but that overall the burdens are reduced as much as possible overall, and that without these kind of policy interventions, a profit-driven monopoly energy system that is regulated by the MPSC, it has very little accountability to impacted communities and does not advance energy justice in a status quo situation. So, as seen from the HIA perspective, we need to wield that power in the decision-making process and utilize these tools so we can do that. Next slide. I think this is passing back to Amy. Thanks so much, everyone, for listening today.
Yeah, thanks, Michelle. We just wanted to close by sharing a couple of resources here for additional information for those of you who may be interested in digging in a little bit deeper into the question of energy production and its impacts for health in the Detroit metropolitan area. In addition to some work that's been produced by some partnerships, the Community Action to Promote Healthy Environments Partnership in Detroit, there are some other additional resources here, some work by Planet Detroit, which is an incredible source of weekly local environmental news. MEJC, which is Michelle's organization, has an incredible website and always lots of balls in the air if you're interested in what's happening around energy. And then, of course, the Work For Me DTE coalition. Here's the link to that. We can go to the next slide. I want to thank all of the members of the presenting team today for all of their work, coming up with this idea and then bringing it to fruition and to actuality. It's exciting to see the products that have come out of this. I also want to acknowledge Ricardo DeMajo, who is the man behind the mirrors who produced most of the maps that we saw today, for his really hard work on this issue. And I want to just close with a thank you to the Integrated Health Sciences Corps for allowing us some space within their webinar series to share this work. And if we can go to the next slide. I want to just highlight before we turn to questions, there are 3 more webinars in this series coming up. The next one will be March 23rd, and it will focus on water and health with a heavy focus on the Detroit water shutoffs and their implications for health in the DMA. On March 30th, we will be featuring a team that has been working in Detroit on climate hazards, housing, and health, talking about some of their really amazing findings and the work that they're doing. On April 20th, we will be hearing from the Community Action to Promote Healthy Environments team about their work, which is a research to action project focused on air pollution in the Detroit area. And then we have a final session that's not on this slide that just dawned on me that will be focusing, it will be in late April, and it will focus explicitly on the links between environmental racism, and residential segregation, and environmental justice. We will get that information to you. I apologize if we didn't get it onto this slide. So we have a few minutes. If folks have questions, comments, feel free to chat them, put them into the chat. Or I think you can unmute yourself if you want to just ask them. And Sarah, let's see, says, thank you for a great presentation and helpful research. On the recommendation side, could you please expand a bit more on affordability assessment? Are there specific publicly available tools that could be used for this as well as an HIA?
I'll jump in real quick. I saw Michelle smile too. But I mean, Sarah, I think you know that that's one of the challenges. So we created this model to look at energy burden using some kind of national and state level data from Department of Energy. But, I think one of the things that particularly the folks in the low income working group on energy waste reduction have been pushing for is data from the utilities on, aggregated at census tract level or zip code level on arrearages, on shutoffs, which would give us some insight into affordability challenges at the community level. And so we have these modeling efforts that give us estimates, but some additional data would definitely help with that, Sarah.
Thank you, Dr. Reames. Yeah, I would just add, that the data that we've seen is that the industrial rates in Michigan really have remained flat over the last 20 years, while the residential rates have increased exponentially. So I think that there's a much larger problem in Michigan around who bears the burden of the energy system. And requiring the data from the utility is absolutely critical. We haven't been able to get that kind of data. And while they claim in certain instances that they don't collect the data, there are things that they do collect that is not publicly available. So we really cannot create a good assessment of who is carrying this burden when we don't know, for example, by census tract, who is receiving energy efficiency assistance or LIHEAP dollars or additional pathways for energy assistance. So, these are then pushed back out into the intellectual landscape where we're, clamoring to find that data when it's there, it's just not shared. So, that is a huge part of it. I would also add that, other states have cracked the code on percentage of income payment programs that they just say, hey, look, if you're paying over 7% or 17% of your income on an energy bill, that should be illegal, right? And as a value statement in Michigan, you need heat to live in the winter. It is a polar vortex that is knocking on our door, and as we saw in Texas, is life-threatening and imminent. So those things are there, they are available, but the political will is actually what we need.
Thank you, Tony and Michelle. Marie.
Yes, I want to thank everyone. This was a fantastic presentation, and I was interested in what Carina presented about the benefits if DTE were to close the power plants. And I'm thinking about Texas and, you know, some of the bad press that renewable energy was given in the recent, you know, disaster that recently that occurred there. And I'm just wondering for this group, what might be some of the next steps? Because the question that comes to my mind is, if you were to close these plants, what would then provide the energy in a more equitable, you know, way and address some of the health impacts that you guys discussed?
Yeah, so I want to let others answer that as well, but I just want to jump in with some facts about that. The emissions estimates that we were using for those future scenarios came from DTE and accounted for the increased use of the natural gas plants and also for some aspirations with regards to solar. So they accounted for, you know, and we accounted for the other energy sources that would be needed, and still saw these dramatic decreases in air pollution.
Michelle, I'm guessing you might have something to say on this question.
Yeah, I mean, Michigan can do so much right now in terms of renewable energy. I can't understate that, you know, we have a 15% renewable energy standard, which is far behind other Midwestern states. You know, we can lift the cap on energy efficiency and renewable energy, rooftop solar. We can dramatically invest using federal funds that are coming down the pike now on renovating people's homes and getting our energy efficiency rates much, much higher. These are beyond low-hanging fruit. This is felled fruit at this time. So we're in a situation where we're you know, going to Congress and asking for resources to provide the kind of just transition that we need from these coal-fired power plants to make sure our workers have good jobs, to make sure that the community's tax base is taken care of, to make sure that our workforce is retooled for a 21st century economy. And that's the kind of vision that we all are carrying, right? When we're saying, like, close down this old dirty stuff, right? This 20th century technology, and let's start moving into areas that Michigan is frankly behind the ball on. So we're really excited for the clean energy economy, and sky's the limit really at this point.
Thanks, Michelle. I just want to thank Allison, who tracked down the missing presentation from our slide. On April 13th, Donnell Wilkins and Catherine Savoy will be giving a presentation on environmental racism and environmental justice. This is not to be missed. These are two very long time advocates, environmental advocates, who have been doing this work since the 90s. And so I think we're very fortunate that they'll be sharing their thoughts with us. Okay, and Bridget put into the chat that MEJC submitted comments alongside other organizations in the COVID docket, advising the Commission to adopt a definition of energy affordability that takes into account a household's income to determine what constitutes affordable. Thank you for that, Bridget. Other questions? Feel free to pop them into the chat, raise your hand. I'm trying to scan so I don't miss anybody.
Yeah, well, while folks think of their question, I just want to recognize Bridget Weil, who is an amazing energy organizer with Michigan Environmental Justice Coalition. Say hi, Bridget. And she's responsible for the troublemaking that happens in Lansing and beyond. So thanks, Bridget, for all your hard work.
Michelle, on that note, I know one thing we talked about in our planning meeting was just letting people know there are ways that they can get involved. And one of those ways is public comment.
Yeah, absolutely. I'm going to hand the mic to Bridget so you can hear her voice and her leadership on this piece.
Yeah, so as Michelle pointed out, Governor Whitmer's executive order directed the MPSC to actually consider environmental justice and public health in future IRPs. So the consumer's IRP, their next 15-year plan, is the first one that's to be impacted by this. And right now, the staff are putting together their set of rules, like how do we consider public health impacts and deciding to say, like, yes or no, you can build this new gas plant, or or you cannot. You can maintain this level of energy efficiency, or you can't. You have to go higher, right? So it's like you consider these criteria, and then you have to make some decision around it. So the MPSC staff are making rules around that right now, and I can put in the chat a link to file comments with the Michigan Public Service Commission and urge them to adopt. In each set of criteria, we need to be looking at impacts that are different based on race, based on income, based on geography, and remediating them. So we need to have the data to begin with, and we need to have it as a value standards that we can actually make rules by to reduce the pollution burden in communities like Southwest Detroit on the east side of Detroit. So I'll put a link to an email address where you can file comments in that docket.
Thank you, Bridget. I think that we're scheduled to end at 12:50. I'm seeing some nods. So I want to thank all of the presenters for their time today and their time in doing this work. I also want to acknowledge the M-LEEaD Center for their support for this work, and our Stakeholder Advocacy Board. I'll just close by saying that one of the primary goals of the M-LEEaD Center is to provide a space for where researchers can hear from communities who are experiencing environmental injustices about their environmental health priorities, and also to create a space where our science gets translated into decision-making processes that are intended to protect the health of the public. And I think that this project is such a wonderful example of that work. So thanks to all who have supported it all along the way. Lots of thank yous coming in. Thanks, everybody. Great conversation. We'll see you at some of the later sessions. Bye-bye.
Bye. Thanks.